Good afternoon. This is Dr. Cynthia Go speaking from Singapore, and I send my warmest greetings to everybody who is present in Seoul at the 20th anniversary of the Korean Society for Hospice and Palliative Care. I'm so sorry that I'm unable to travel to join you there, but I hope that you will be able to take on this presentation. In this talk, I would like to give a perspective of the international scene and Korea's role in the formation of two of the three international organizations representing hospice palliative care worldwide today. This is the Worldwide Hospice Palliative Care Alliance, the WHPCA, and the International Children's Palliative Care Network, the ICPCN. I shall concentrate on the Worldwide Hospice Palliative Care Alliance, which is what the title of my talk was, and tell you the story, the background that I know about how it got started, and how Korea played an absolutely key role in the setting up of this organization. It was a chance conversation in 2002 between two CEOs of two national associations of palliative care, Mr. David Prale and Ms. Tonya Barnes, then CEO of Palliative Care Australia. David was at that time CEO of Help the Hospices UK. And they found that their organizations had several things in common and several things that they need. During the conversation, they decided, well, why isn't there an organization that represents and speaks for hospice and palliative care internationally? So, over the next several months, a meeting was planned, which is now called the First Global Summit in Hospice Palliative Care. And it was held at The Hague, Netherlands, in conjunction with the EAPC to be held at that time in April of 2003. But it was a dark time for the world at that time. It was during the middle of the SARS epidemic, which was first noted in late February in Hong Kong, reached Singapore in March, and which only finally ended when the WHO declared the world SARS-free on the 14th of July 2005. But many of us dared to travel to The Hague, and I represented the Singapore Hospice Council. And there we met on the 1st of April of 2003. We all made little presentations about our organizations and our aspirations for a worldwide hospice organization who could represent hospice and palliative care. At the end of the meeting, we called for the formation of an international organization to be the voice of hospice palliative care worldwide, and we decided to meet again. At that time, the International Association for Hospice Palliative Care, the IAHPC, was quite a quiet organization, mainly concentrating on academic work and not doing much advocacy, unlike what it is doing now. So in trying to decide where we should meet next, I offered the occasion of the next Asia-Pacific Hospice Conference, which was to be held in Seoul, in Korea, in May of 2005. And I was very pleased that the organizers of that conference embraced this and welcomed this global group to come and join it and form its own pre-conference workshop, later known as the Second International Global Summit. The Second Global Summit was held in Seoul, in Korea, on the 18th of March 2005. And the theme was Hospice and Palliative Care is a Human Right. And the Global Summit in Korea demands governments to do more to meet the needs of the dying. At that meeting, there were 70 delegates from 35 countries, and we ended up with a Korea Declaration. The Korea Declaration states that governments must include hospice and palliative care as part of all government health policy. It must make hospice and palliative care a human right, and include palliative care in their national aid strategies. The Korea Declaration also states that governments must identify and eliminate barriers in the laws and regulations in different countries to the adequate use of opioid analgesics such as morphine, and strive to make hospice and palliative care available to all citizens in the setting of their choice, including acute care hospitals, long-term facilities such as nursing homes and residential hospices, and in the patient's home. And here are some samples of people who signed the declaration. For example, you can see here people from Ukraine, from Canada, UK, Taiwan, Romania, Hungary, Philippines, Malaysia, US, and Singapore. and some more, including people from the UK, including Joan Marsden, who is the founder of ICPCN, Dr. Rajagopal from India, and also Anne Merriman from Uganda. Now I just want to mention briefly the ICPCN, the International Children's Palliative Care Network, which was also given its birth in Korea, originally part of WHPCA. And later on, it branched out on its own. Now, the ICPCN is extremely active. It has its members, 373 organizations from 125 countries. It is very active in producing resources, in social media, in networking with an online directory. And leading it now is Julia Downing, who is ably forging ahead with the strategic development of the ICPCN. Well, the WHPCA wasn't born in a day, and even after the Seoul 2005 meeting, we continued to have to meet, and we tried to be as globally represented as possible. David Prell and I were the co-chairs, and you can see in this picture Joan Marsden, Liz Gwither, Sharon Baxter, people like Lucas Radbrook, Anil Peleri, Stephen Connor at the back, Daniela Musso from Romania, and so on. So we met approximately once a year, and some of the meetings were really quite memorable. For example, we met in Lima in Peru, and during the meeting there was an earthquake. There was an underwater earthquake about 6 miles out from the coast of Lima, and we all had to evacuate the hotel and stand around waiting to see when it was safe to go back. And some of the highlights of the WHPCA development. First, we had the March Global Summit in Seoul, and we then organized the first World Hospice and Palliative Care Day, also in 2005, and we set up a steering group meeting near London in Henley. We published the Advocacy Toolkit, then we had another steering group meeting in Montreal, and the third Global Summit of National Association in Nairobi in Kenya, during the Africa Palliative Care Association meeting in 2007. Some other highlights of the WHPCA development. The Association Toolkit was published in 2008. Palliative Care Toolkit was published. And Stephen Connor was loaned to us as an executive by the National Hospice Palliative Care Organization of the US. And that made a big difference to our work. We were also working on registration, legal registration in the UK as a charity. And finally, in 2009, the WHPCA became a legal entity in the UK. A few years later, we formed eHospice, which is this app which produces hospice news. And I can show you the people behind it. This is Kate Jackson, who runs eHospice. This is the lady on your left-hand side. There's Joan Marsden in the middle. And there's me, and we were attending the EAPC in Prague in 2013. Some highlights. Accreditation of UN ECOSOC because an official relations with WHO. We wanted to be a global advocacy organization, but not everybody can just walk up to the WHO and talk to them. You have to be properly accredited. And for the longest time, we had discussions about what our name should be. And officially, we started off with the name WPCA, which is Worldwide Palliative Care Alliance. And later on, we added back the hospice, which many of us regretted leaving out. And in 2013, we changed the name back to Worldwide Hospice Palliative Care Alliance. 2014 was notable in that we published, together with WHO, the Global Atlas of Palliative Care. And also 2014, of course, was the year that the World Health Assembly, which is the meeting of health ministers every year in Geneva, to set out the work plan for the WHO in May each year, they passed a resolution on palliative care. So this was the photograph commemorating many of the people who took part in the advocacy that pushed through this first resolution on palliative care at the World Health Assembly. Then collaborative global advocacy highlights include, of course, the first World Hospice Palliative Care Day in 2005, the 2008, the UN Special Rapporteur on Right to Health report, which includes palliative care as a neglected issue, to the UN General Assembly. In 2011, Palliative Care in Non-Communicable Diseases Global Plan. and the UN Political Declaration and first palliative care indicator in WHO World Monitoring Framework. It is so important to have an indicator to measure how well palliative care is doing. Of course, 2011, we also published the first global atlas on end of life, although that took until 2014 to become reality. 2013, palliative care was included in the definition of universal health coverage. So if you want to provide universal health coverage for citizens of your country, every government has to provide palliative care. And of course, 2014 was the World Health Assembly Palliative Care Resolution adopted. And palliative care was included in the Global Action Plan on Dementia and Cancer Resolution in 2017. The global need for palliative care, the Global Atlas of Palliative Care, was published in January of 2014, and much more recently, last year in 2017, and this meeting took place in May of 2018, the Lancet Commission report on palliative care and pain relief, which highlights the alleviating of the access abyss in palliative care and pain relief, an imperative in universal health coverage recommended by the Lancet Commission report. Other program highlights of the WHPCA, it initiated the Coral Slum project in Bangladesh, which is training palliative care assistants from the community to look after people needing palliative care within the slum itself. And this Coral Slum is one of the largest slums in the world. It lies in Dhaka, which is a sprawling city of 18 million people, and just one block away from the polished shops and embassies of Gulshan in Dhaka is the Coral Slum. And currently, the Coral Slum project is supporting over 100 older people and their families. Then there's a palliative care toolkit, which has been translated into 9 languages, and new programs are being developed in the Middle East and in Ethiopia. These are awaiting funding. You can download much more information about the WHPCA, building integrated palliative care programs and services. And of course, World Day, World Hospice and Palliative Care Day. Now it is established every year. And last year, the theme was Universal Health Coverage in Palliative Care. Don't leave those suffering behind. And I hope many of you are planning to organize events for World Day this year. And you can find that on the World Day website, which is www.worldday.org. 177 events in 50 countries were organized in 2017. So let's see how many we can organize this year in 2018. So this is just a very quick update on the progress of the Worldwide Hospice Palliative Care Alliance and also of the International Children's Palliative Care Network. Thank you very much.